We live in a world teeming with unseen life. Microscopic organisms, both friend and foe, surround us. Among these are bacteria, single-celled organisms capable of causing a range of illnesses. For centuries, these invisible enemies plagued humanity, causing widespread suffering and death. Then came a revolution, a medical miracle in the form of antibiotics. These powerful drugs capable of killing bacteria have saved countless lives and transformed the practice of medicine. Antibiotics are chemical compounds that can inhibit the growth of or destroy bacteria. They work by targeting specific mechanisms essential for bacterial survival, such as cell wall formation or protein synthesis. It is crucial to understand that antibiotics are effective only against bacteria. They are useless against viruses, which are fundamentally different entities. This distinction is vital to ensure the appropriate use of these life-saving drugs. The discovery of penicillin, the first antibiotic, was a serendipitous event that changed the course of medical history. In 1928, Scottish bacteriologist Alexander Fleming noticed a peculiar phenomenon in his laboratory. A petri dish containing Staphylococcus bacteria had been accidentally contaminated with a mold. To Fleming's surprise, the mold, later identified as Penicillium notatum, inhibited the growth of the bacteria around it. This accidental observation marked the beginning of the antibiotic era. Fleming's initial discovery, while groundbreaking, faced significant hurdles. It was difficult to produce penicillin in large quantities, and its therapeutic potential remained unrealized. This is where the contributions of Howard Florey and Ernst Boris Chain proved crucial. These scientists, working at Oxford University in the late 1930s, developed methods for the mass production and purification of penicillin, making it available for clinical use. The introduction of penicillin in the 1940s revolutionized medicine. Bacterial infections that were once death sentences became treatable. Pneumonia, meningitis, and sepsis, previously responsible for countless fatalities, could now be effectively combated. The impact on surgery was equally profound. Surgeons, once limited by the constant risk of post-operative infections, could now operate with greater confidence, leading to advancements in complex surgical procedures. The impact of antibiotics extended far beyond the hospital walls. These wonder drugs played a pivotal role in improving public health. Infectious diseases, once rampant in crowded urban areas, were brought under control. Life expectancy increased dramatically as antibiotics helped to curb the spread of deadly bacterial infections. The discovery of penicillin ushered in a golden age of antibiotics. From the 1940s to the 1960s, researchers around the world raced to discover and develop new antibiotics. This period saw the emergence of numerous classes of antibiotics, each targeting different types of bacteria. Streptomycin, discovered in 1943, proved effective against tuberculosis, a debilitating and often fatal disease. Tetracyclines, discovered in the late 1940s, exhibited broad-spectrum activity targeting a wide range of bacteria. The discovery of these new antibiotics fueled optimism. Infectious diseases, once formidable foes, seemed poised for defeat. The future of medicine appeared bright with the promise of a world free from the scourge of bacterial infections. Section 6. The looming threat of resistance. This optimism, however, was tempered by a growing concern: antibiotic resistance. Bacteria, those microscopic marvels of adaptation, were evolving, developing ways to survive in the presence of antibiotics. This resistance, first observed in the early years of antibiotic use, has steadily increased, posing a significant threat to global health. Antibiotic resistance is a natural phenomenon, a testament to the remarkable adaptability of bacteria. However, human actions have significantly accelerated the development and spread of resistance. Overuse and misuse of antibiotics are the primary drivers of this growing crisis. Section 7. The causes of antibiotic resistance. The widespread use of antibiotics, often unnecessarily, creates selective pressure that favors the survival of resistant bacteria. When antibiotics are used to treat viral infections for which they are ineffective, they kill susceptible bacteria, leaving resistant strains to thrive and multiply. The overuse of antibiotics in agriculture further exacerbates the problem. Antibiotics are commonly used in livestock feed to promote growth and prevent infections. This practice contributes to the emergence and spread of resistant bacteria, which can then be transmitted to humans through food consumption or environmental exposure. Section 8. The importance of responsible antibiotic use. The consequences of widespread antibiotic resistance are dire. Infections that were once easily treatable are becoming increasingly difficult to manage. Hospital-acquired infections, often resistant to multiple antibiotics, pose a significant threat to patient safety. Addressing the challenge of antibiotic resistance requires a multifaceted approach. Public awareness campaigns are crucial to educate people about the importance of responsible antibiotic use. This includes understanding when antibiotics are necessary and when they are not. Completing the full course of antibiotics as prescribed, even if symptoms improve, is essential to prevent the emergence of resistance. Section 9. The unending quest for new weapons. In the face of growing resistance, the search for new antibiotics is more urgent than ever. Researchers are exploring novel approaches to target bacteria, including developing drugs that interfere with bacterial virulence factors or disrupt quorum sensing, the communication system used by bacteria to coordinate their actions. The development of new antibiotics, however, is a complex and costly endeavor. The pipeline of new drugs is dwindling, and many pharmaceutical companies have shifted their focus away from antibiotic research. Government incentives and increased investment in research and development are crucial to stimulate innovation in this critical field. The fight against bacterial infections is a never-ending battle. As we celebrate the remarkable achievements of antibiotics, we must also acknowledge the challenges posed by resistance. Responsible antibiotic use, coupled with ongoing research and development, is essential to preserve the efficacy of these life-saving drugs for generations to come.